Thank you very much. This is indeed a great opportunity. So thank you very much to Kini Academy for actually having me. And thanks to everyone who is here today to be a part of this masterclass. And I really wish that this is happening, differently with me actually meeting all of you, because I like that discussion. I like you to interrupt me and to ask me questions. Unfortunately, we don't have that kind of a privilege at this point in time. So I guess we just have to make do with whatever we have. And I'm going to share with you whatever I have known, whatever I know from my work on the ground with migrant workers, not just in Malaysia, but also Southeast Asia, and also the kind of research that I've done and the presentations that I've been a part of, and also having learned from many other experts globally and from the region as well. So I hope that, this is not about me being the expert, as Danny continuously says, because I believe that all of you know what I'm going to say, but, I just hope that we can both work together, and I really look forward to the collaboration and also the reporting in which we can both be a part of. I'm really looking forward to that. So I'm just going to go straight to what's happening in the region. I know all of you know what's actually happening. It's just that, at the beginning of, at the end of January last year, World Health Organization declared that we actually have an outbreak, we actually have a pandemic. And until then, people were not really very sure as to what the COVID-19 was all about, or the kind of ruckus and mess that it is actually going to create, the havoc that it's going to cause throughout the region, and the kind of loss of jobs and loss of income and even suicides that it is going to trigger. So, we were kind of anticipating that this is something that will actually come on and then pass off. But then I think that, as what even the Malaysia's newly minted health minister has said, it is something that we have to contend with. COVID-19 seems to be something that we have to live with. And I think in this aspect, Singapore has done really well in terms of acknowledging the fact that COVID is actually here to stay, and looking at mitigating our lives around that. So, COVID-19, the first region that it has actually hit severely is the Southeast Asian region, and us in ASEAN are the ones who have been hit first. And if you ask me why, that's because of the close geographical proximity to China, the business that we have with China, the travel and tourism that we have with China. So the thing is that, now, yes, of course, Malaysia was one of the countries that came out looking really great, because, it seemed that in 3 months, we had managed to mitigate the pandemic. The cases were down to almost 1, and everyone just was really thrilled. And Thailand had also done a great job, but, it is just that we realized that because Thailand has at one point also stopped the kind of proactive testing, and Malaysia did not really bother about doing rapid testing involving migrant workers. It's like, everyone was trying to somehow or other get rid of this pandemic really quickly, and every government took the easy way out. We are now seeing waves and waves of COVID-19 infections, cases, raging across countries, and the number of deaths alarming. In Malaysia, we went into a total lockdown when there were 200 or 300 odd cases, and everyone was like, wow, 300 odd cases? Oh my God, what's happening? But now we have got 20,000 cases, and we don't really know how to deal with it, and neither does the government. But we'll talk about that a little bit more. The thing is that, what we are seeing now is that, we are hit with job losses, income losses, people attempting and committing suicides. And we have come to a point where there is an economic downturn, primarily caused by the continued lockdown, global disruption to trade. And unfortunately for us, the people of ASEAN, we may be looking at a recession. Now, if you look at how have ASEAN countries actually responded, well, they have responded. And I know we want to talk a little bit about the Declaration on Strengthening Social Protection. And I will talk about the social protection throughout this 35 minutes, because that is where we have actually failed, and failed quite miserably. And I think that needs to be talked about a little bit more, so that we know, what kind of pressure and lobbying efforts that need to be put on individual governments to ensure that those who are really vulnerable can be protected. Now, the first slide, we were talking about what was actually happening in ASEAN. But, if you really take a step back and ask yourself, yes, we, the people of ASEAN, small and medium industries, people, students, activists, businesses, all of us have been affected. But who or which group has been affected the most? And that's without a doubt the migrant workers. And that is because, when we look at, because we know that it is the small and medium industries, services, as well as tourism sectors that have been mostly affected in Southeast Asia. And if we look at who is working these sectors, these are definitely migrant workers. How has ASEAN actually, or ASEAN countries responded? They have responded with stimulus packages. But, if we really take a step back and look at where these stimulus packages went, how much of it went directly to support the communities, people that were really affected? How many of these stimulus packages were targeted towards social protection, towards people like the migrant workers, both in the informal sector and the formal sector, both documented and undocumented? And if I may expand this a little further, even though we are talking about migrant workers specifically, how much of this stimulus package were actually targeted towards people like refugees, for example, asylum seekers, stateless people, people with precarious immigration status? The answer is, to a large extent, we can safely say that not much of it, or very little of it, was actually targeted towards creating a social protection or creating security and safety mechanisms for those who are vulnerable, and primarily the migrant workers. Now, if we look at Thailand did give about, if I'm not mistaken, $150 targeted toward migrant workers from April to June last year. If we look at Malaysia, it has failed miserably. I work on the ground. As Danny introduced, I do run a non-profit organization called Beyond Borders Malaysia, and we have been doing aid distributions from last year right up to today. We have reached out to about 80,000 families. We have done, even the last 1 to 2 months, we have done tens of thousands of meals to poor and vulnerable communities. And that is primarily because the Malaysian government, just like any other ASEAN government, has also failed miserably to include. Now, the word is being inclusive, which I think is just not in the vocabulary of many governments. So it has failed to actually include migrant workers in its fiscal response packages, which means migrant workers are left to fend for themselves. Now, we see that SMEs and sectors, services sectors, and also tourism sectors, manufacturing, construction, these are the ones that have really taken a bad hit, and they're largely worked by migrant workers. So what happens when there is nothing to actually help them? Well, the answer is what I'm seeing on the ground on a day-to-day basis. There are relentless calls and text messages to us for food, for essential items, for groceries, for vegetables. And, we see governments, whether it's the Malaysian government, the Thai government, or even the Indonesian president going on his, bicycle, looking really, sporty, talking about wearing face masks, being safe in public, talking about social distancing. But let me ask you a question. We all know that migrant workers live in very precarious situations. They live in congested environments. They live sandwiched like sardines in small apartments. How is social distancing possible? Whether it's Singapore, whether it's Thailand, whether it's Indonesia, whether it's Cambodia, the plight of the migrant workers remains the same because of, or at least let's look at the accommodation. The accommodation is really left wanting. So how do we get them to do social protection when social distancing is actually a privilege? It's a privilege for a lot of, it's a privilege that many of us actually take for granted, because we have the space and we have also the capacity to buy ourselves sanitizers. Some of us have sanitizers for the home, and we buy masks in bulk because we are just terrified of running out. But when you have lost your job, when there is no income, when there is no possibility of livelihood, when you don't even know when cases are going to reduce, or if cases are going to reduce, and when that's going to happen, how are you going to spend that little bit of money that you have to buy yourself these protection, whether it's masks or sanitizers? So that is the situation of the migrant workers, not just in Malaysia, but in different parts of the region as well. Now, what happens when they live in precarious situations without social support from states, from governments? That actually contributes to the rising infections that we continue to see on a day-to-day basis. It gives rise to the number of deaths, which are also increasing. And these are people that actually do not have savings to stock up or anything. So what do you think the government could have done or should have done? Well, it should have provided and reinforced income support, and also put in place initiatives to allow informal workers to register for emergency social support, for example. Now, are we seeing this in any part of ASEAN? Are we seeing this in Malaysia, Thailand, Cambodia, Indonesia? No, because these people seem to have been left out on the brink. These people have been left out to fend for themselves. Now, I've been talking a lot about migrant workers and how they're actually treated by different governments in ASEAN. But if you take a step back, many public health researchers were astounded with the success of Malaysia and Thailand, and rightfully so. We came out looking great, and so did Thailand. But unfortunately, especially Thailand, in minimizing community spread, for example. But now, because of the continued mutation of the virus, and also because of the lack of proper policy put in place, there have been recent outbreaks in Malaysia as well as Thailand. And we can, if we want to look at three countries in ASEAN, we need to look at Thailand, Malaysia, and Singapore, which were actually badly affected. And also because major outbreaks did involve migrant workers, and in Malaysia and Thailand, it continues to involve migrant workers. Now, policy, if we really look at what kind of policies have these governments, Malaysia, Thailand, and Singapore, adopted in terms of looking at these rising infections amongst migrant workers? Now, I can safely say that the policies were discriminatory against migrant workers, including attempts to segregate them from the rest of the population. So when you look at Thailand, primarily Singapore, and also Malaysia, this has increased racism and xenophobia. And it is also interesting in the case of Thailand. Let me give you a story. There were about 400,000 migrant workers in Thailand's seafood processing sector. And many of them, or mostly, they came from Myanmar. They live in very difficult conditions, congested accommodations, and they speak very little Thai. Now, in December 2020, there were rapid testing done amongst people who were in this sector, and 12,000 specifically. There were 12,000 specific cases during the testing. And then as they tested more, there were many more thousands. Now, I can't ask, if you look at how the Thai Prime Minister actually responded to these alarming number of cases amongst those who actually worked in Thailand's seafood processing sector, it's actually mind-boggling, because this is what he said. He actually accused the Myanmar workers, and he said that by smuggling themselves across the border, that they had actually brought COVID-19 into the country, into Thailand. But what Mr. Prayut forgot to actually say is the fact that, Thailand's government officials were actually the ones who were playing a primary role in allowing for these illegal smuggling of workers from Myanmar across the borders. Now, if we look at Malaysia has also had a similar experience, in the sense that for decades, our NGOs have been talking about bad accommodation and the fact that migrant workers were working long hours and they were living in congested environment. Now, even though there was lots of effort, lots of lobbying efforts, it did not actually change any policy where the government is concerned, because the government kept going after migrant workers and not even after the labor agents, the employment agents, or even Malaysian employers. So, sometimes when I talk to my friends and fellow human rights activists and those who actually work on the ground, they tell me things like, this is karma biting us back. This is like karma giving it back to us because of the way we abused migrant workers. Now we are forced to contend with actually looking at their accommodation, looking at reversing policies, looking at putting in place safety and security mechanisms so that this infection can actually be contained at this point in time. And, also in Malaysia, we had last year, because of the segregation policy, we also had huge suppression of the media, primarily Al Jazeera, because it went on to report about the working conditions, and it also went on to talk about corruption involving immigration officers and the difficult and dangerous conditions in which migrant workers were working. I'm just going to touch briefly about this because I'm sure all of you know about what has actually happened. And we had we had immigration raids, we had the authorities going after Al Jazeera, and we also had the former government, which was led by Muhyiddin Yassin, did not do anything in terms of leadership to contain or to condemn those kinds of victimization of migrant workers. Neither did it do anything to condemn the suppression of the media, suppression of freedom of expression and freedom of the media. Now, if you really look at all of this, the way ASEAN governments have actually responded to the COVID-19 pandemic in terms of, in relation at least to where the migrant workers are concerned, they have done it using segregation policies. They've done it using a lot of creating a lot of fear factor. They have done it. They have done a lot of victim blaming the migrant workers, and they have tried to stay away from blame. Now, what has all of this done in terms of where COVID-19 pandemic is concerned? Because what is actually contributed? What is to severely impact in undermining the pandemic management by all these respective governments, and that includes Malaysia, Thailand, and Singapore to a large extent, even though now in Singapore we are seeing that the cases have been contained, but the racism, the xenophobia, the hate against the migrant workers in Singapore has actually become worse because of following the pandemic. Okay, so before the outbreak of the COVID-19 pandemic, there were at least 10 million international migrant workers in ASEAN, out of which 50% were women. Now, it is really interesting to look at how we have, or the media has, or governments have looked at the response to the pandemic in relation to women migrant workers. Now, if you really look at this, between 10 to 70% of the migrant workers in Malaysia, in Southeast Asia, work in informal sectors. And when you talk about informal sectors, the first vision that comes to your mind, or the first picture that comes to your mind, is the picture of women workers, because they are the ones who largely work in these informal sectors. And they face specific challenges as they are at the core of the COVID-19 response. It curtails their income, and they are also more vulnerable to layoffs, and they are less eligible for support mechanisms. And also there is an increase in domestic violence amongst migrant workers who are here with their families as well. So if we really take a step back and look at Singapore, for example, Singapore's Association of Action and Research, which is actually a women's helpline, recorded an increase of 33% of domestic violence cases over the previous year. And if you look at Indonesian Women's Association for Justice and Legal Aid Institution, it saw a threefold increase in referral cases over a 2-week period from the time women were asked to stay at home and work. Now, most of these women may not include migrant workers, but I just want to give you a sense of how women, whether they are migrant workers or otherwise, are the ones who are even more affected because of the COVID-19 pandemic. Now, I would like to also talk to you a little bit about a particular case that I worked on in Malaysia involving a migrant worker. Her name is Risa. She's Indonesian, and she actually was supposed to come and help us clean the house. But I was waiting, and she didn't turn up. And I thought, okay, let me call her mother. I called Risa. I couldn't get hold of her. I called her mother, and the mother said, you know what? She has already left. And I asked her how long ago, and she said, about 30 minutes, 45 minutes ago, she was walking to your house, and it takes about 5 to 8 minutes to get to your place. And I was thinking, okay, but I can't find her. So I was actually really worried because, I thought that maybe she has had an accident or something had happened to her along the way. But, a few hours later, about 6 or 7 hours later, she calls us and tells us, she was hysterical. And she told us that when she was walking to come to our home, there was a person who was sitting in a car who opened the car door and asked her, who are you? Where are you going? And she said, okay, my name is Risa, and I'm a migrant worker, and I'm going to, clean this person's house. And the person is like, let me look at your visa. Let me look at your passport. And she was like, okay, so I don't have documents. And he was like, in that case, I need you to get into the car. So this girl, who's a very young girl, was terrified, and not knowing what else to do, she got into the car. And she said that this man actually drove her round and round and round for a few hours before taking her into his apartment. And when she got there, he asked her for sex. She said no. He slapped her, hit her, punched her. And she did not tell me whether she was forced to have sex with him or not. And I really didn't want to push or ask her, because I thought if she had wanted to tell me, she would have done so. So now this is not just one case, but there are many such incidences which are happening. And if you really look at even the law that is put in place where migrant workers are concerned, for example, say Risa has been raped, and I go to the police station and lodge a police report. Do you know what's going to happen to Risa? I'm not going to get police officers coming and talking to her, or women police officers coming and talking to her, trying to find out who is the person who raped her, or if she was gang raped, if that was the case. Nothing of this sort is going to happen, because when it involves an undocumented migrant worker in Malaysia, the first law that kicks in is the Immigration Act. It takes precedence over everything else. So what comes into question is the fact that she doesn't have visa on her passport, that she has a precarious immigration status, which means that before I can say cheese, she will be picked up and she will be in prison. She would have been detained. The fact that she will never ever get to go to court or seek justice or make sure that the perpetrators serve jail time or any of those things. So this is actually the kind of persecution, for lack of another word, that migrant workers, and primarily women migrant workers, are facing in not just Malaysia, but also different parts of the world. Now, in the next slide, you will see that Malaysia's former Prime Minister, Mr. Muhyiddin Yassin, actually called for a coherent, multi-sectoral, multi-stakeholder approach to ensure effective response to the pandemic. And of course, the 26th ASEAN Economic Ministers meeting in March last year talked about, came up with a statement which looked at a collective effort, a collective action, in particular focus on leveraging technology, for example, and digital trade to foster supply chain amongst the different countries in ASEAN. And also it talked about rollout of a post-recovery plan. But let's look at how inclusive these action plans are, how inclusive of migrant workers these action plans are. So let's look at Thailand and Malaysia, because these are the two countries which are actually battling widespread infection, daily cases, as well as deaths. Now, going back to the social protection, there has been no social protection measures that actually looks specifically at including migrant workers in both Malaysia and Thailand. In June 2021, just a few months ago, the Thai Prime Minister, Mr. Prayut, closed campsites for construction workers for until like early July. And that pushed them to live in very congested spaces with limited access to medicine and food. Now, this seems to be the kind of immediate, I won't use the word response, I will use the word reaction that ASEAN governments have to trying to mitigate the spread of infections. And then what happened is, following what the Prime Minister did, his labor minister stopped all proactive COVID-19 testing. And when you look at Malaysia for a long, long time, despite lots and lots of lobbying efforts by parliamentarians as well as non-governmental organizations and human rights activists, lobbying the government to actually do rapid testing so that we can know the exact number of cases. Malaysia also did not do that until very recently. And there's also been a lot of flip-flop on policies, in terms of standard operating procedures during total lockdown, during the recovery phase. And also, just like Thailand, there has been every effort to kind of play down the number of cases and infections on the daily rate. Now, if you really look at ASEAN governments, while they do talk about being inclusive, taking account of all stakeholders, unfortunately, migrant workers who have always been at the core, at the heart of development in each of these countries, have always been left out. So let's specifically look at Malaysia's story. Last year, I'm sure all of you know this, the Malaysia's defense minister actually said that, he said this to migrant workers as well as refugees. He said, please come out and get tested. And we promise you that, we are not going to target you. We promise you that we will not go after you. There will be no witch hunt, that there will be no immigration raids. But a few months into that promise, immigration raids started happening. And that was when Al Jazeera started reporting about these raids, and also the kind of corruption and the kind of inhumane treatment at the hands of immigration officers that actually got them into trouble. Now, if you really look at what's happening currently in different countries in Southeast Asia, and you take a step back and look at the kind of policing that's actually happening, the kind of raids which are actually happening, the kind of persecution, the kind of witch hunt that is happening against migrant workers, it is not, the government and authorities have not backed out one bit. They have not backed down one bit. So you can ask yourself, how much inclusive, or how inclusive do they look at migrant workers in terms of the socio-economic development and also the health crisis that we are seeing at this point in time. In the case of Malaysia, I would think that it had lost a great opportunity to come up with a more comprehensive healthcare and also welfare policy. You look at Singapore, it has also failed miserably in capitalizing on this COVID-19 pandemic to come up with a more inclusive, or I will not even say more, to come up with an inclusive healthcare and welfare policy. If you look at Cambodia, if you look at Indonesia, it is all the same. Now, if you look at the lack of social protection, there was in 2013, ASEAN came up with the Declaration on Strengthening Social Protection, and governments have actually pledged to do so. While this remains good in paper, it has not been implemented on the ground. Because if it had been implemented on the ground, the countries that I just mentioned would have capitalized on the COVID-19 pandemic and would have taken a step back and looked at experts to come up with a more comprehensive welfare and healthcare policy. None of this has happened across Southeast Asia. Now, if you look at protection mechanisms, or if you look at fiscal measurements which have been thrown at migrant workers, these are ad hoc. There is no policy that actually governs it. There is no framework that actually governs it. In the case of Malaysia, there has been absolutely none. But at least in Thailand, you have seen some effort. But like I said, it was ad hoc. It was over a period of 2 to 4 months, 2 to 4 weeks. And it has not really materialized in actually mitigating the COVID-19 pandemic, the consequences, or even creating a safe and secure environment for the migrant workers across the region. Now, even if you look at, for example, you look at what's happening in Myanmar, for example, with the kind of persecution, the targeted persecution by the military, which has increased, which has seen an exponential increase of COVID-19 cases in Burma. And it is, people, my friends who actually work out of Burma say that, it's just so bad. The situation is just so bad that they won't even be surprised if the entire population, minus the elite, are actually, will at some point actually have COVID-19 infections. But the thing is that, if you really look at what stops ASEAN governments from ensuring that there is a proper social protection mechanism, that there is a proper safety mechanism, that there are proper protocols within the social security mechanisms, then you can actually look at the fact that it's not just the non-interference policy, which is so archaic, because, if you look at ASEAN, we have got the ASEAN Economic Community, which is economic cooperation. So while you can have economic cooperation, when it comes to actually looking at the human rights violations by individual governments within ASEAN, then conveniently they use ASEAN's non-interference policy. But, if you look beyond ASEAN's non-interference policy, then you will see that ASEAN has always been challenged by corruption, uneven social development and technological adaptation, environmental degradation, and also the rise of authoritarian governments. We leave it here because I have an idea for all of you to ponder on just before we close this session. Now, we can't talk about migration and forced migration or otherwise without actually talking about the Global Compact for Migration. Now, this is not really ASEAN, it's more global, but I thought I'll just touch upon it a little bit as a way of giving you something to compare against, actually. So this was adopted in 2016 at the UN General Assembly. In a way, it was good because it was the first intergovernmental negotiated agreement. And because it talked about refugees and migrants, then, you can say that to an extent, it sent a very powerful message that matters relating to migration and refugees have actually taken an international stand, does have an international agenda. But the thing is that this Global Compact for Migration actually also says that it respects the sovereignty of each country, which means that the countries can decide who can get to stay in their country or who doesn't get to stay in their country. And more importantly, the Global Compact for Migration is non-binding. Now, if you take a step back and look at the ASEAN Declaration on the Protection and Promotion of the Rights of Migrant Workers, very much in our backyard, then you will see that this is also a non-binding agreement. And it has got very limited scope in effectively protecting migrant workers from exploitation and also from trafficking, right? So, and if you also look at this, the ASEAN's declaration goes a step forward in marginalizing migrant workers, I must say, by saying that this declaration is only effective towards documented migrants and those traveling in ASEAN. Now, this is really important because if you look at the undocumented migrants, most of them work in informal sectors. And the moment they are in informal sectors, then you can safely say that a large amount of these workers are women. So the ASEAN Declaration for the Protection and Promotion of the Rights of Migrant Workers in ASEAN has actually completely negated looking into the protection of women migrant workers, from trafficking and also from exploitation. Okay, so I was actually thinking of talking about the securitization of migrant workers and politics of insecurity, because, you know, the whole rhetoric that we hear time and again, whether it's in Indonesia or Thailand or any other country, it's really about, you know, governments saying that, you know, that they are worried that the rise in migration is seen as destabilizing the nation's security. So this is actually a very populist and nationalistic approach, but it does work because, you know, even in Malaysia, for example, there is a lot of xenophobia and racism and a lot of fear when it comes to migrant workers, and largely because this is fueled on by the government itself. And in Malaysia, if you look at it, we have this thing called Relawan Rakyat, or Rela, which is a nationalist organization. They carry baton and shields, and there are 500,000 volunteers in this organization. And they are largely used to patrol and to nab migrant workers and to check if they've got documents. They are the ones who accompany the immigration when they go on midnight raids. And they are actually a force that everyone the migrant workers primarily are terrified of. But if you look at that, they have got 500,000 volunteers. But if you combine Malaysia's military and police, we have got a total of 101,500 members only. So this voluntary task force, if I may say, that goes around targeting migrant workers and primarily looking for undocumented migrant workers is 5 times more in strength and number compared to the total comparing it to Malaysia's total military and police force. Now, in the east coast of Sabah in 2002, 2003, the same rhetoric of securitization and the migrant workers being a threat to national security was used, and the Sabah government has then been parroting itself and thumping its chest, saying that it has completely weeded out undocumented migrant workers. But, you know, what has actually happened on the ground is that there has been an exponential growth, because when migrant workers come into Malaysia, for example, they come 90 to 95% of them come with legal channels. They come with documents. It's only in Malaysia that they become undocumented, primarily due to labor agents, employment agents, and errant Malaysian employers who just dump them, who take away their passports and do not bother to actually renew the visa. Now, the same thing also happens in Thailand, where you have, you know, migrant workers who actually come from Burma and work in Thailand, who are then at the mercy of Thai employers, and their passports are taken away and kept. And when it comes, when it's time for renewal of their visa, then it's up to the discretion of the Thai employers as to whether or not they want to employ or continue to employ these people, whether or not they want to extend their visa. And again, because they speak very little Thai, they have got no legal recourse. Primarily also, if they are undocumented, then there is no legal recourse for any country, you know, from any country in the region. But what I would also like to look at, you know, besides the securitization of migrant workers and also politics of insecurity, is to actually look at the securitization of COVID-19 itself. Now, you know, for example, the emergency laws have been put in place to silence human rights workers and human rights defenders. The state of emergency law in Cambodia, for example, actually allowed authorities to monitor and gave them the powers to restrict what is being posted on social media. You know, in Philippines, human rights defenders were charged when they were actually out donating and delivering goods and groceries because they had what was quoted as anti-government pamphlets and flyers in their car. In Indonesia, police regulators regularly indulge in arbitrary arrests. And in Timor-Leste, freedom of expression and freedom of the press have been curtailed in light of its national state of emergency. Now in Malaysia, yes, finally the emergency has come to an end, but it was no better because, you know, the government used the emergency to actually do procurements during COVID-19. And because Parliament was not in session, because Parliament was suspended, there were no debates and nobody actually knows as to how these money were actually used. Now, earlier I did speak about this access to vaccination, actually. Earlier, I did speak about migrant workers and how the government went back on its words and how it actually targeted media, not just Al Jazeera, but also local media, to ensure that they were not propagating fake news. Now, the word fake news was so vague that anything that the government construed to be fake news could get media as well as human rights activists into trouble. But what is it that we are seeing now because of the policies that Malaysia's government has actually implemented? Now, the government goes around saying that by the end of October, which is by the end of next month, we would have achieved 80% herd immunity, which means that it's good for the country. But we have been asking the government this question: when you talk about 80%, are you talking about everyone who make up a part of the Malaysian society? Are you talking about migrant workers, both documented and undocumented? Are you talking about refugees, stateless people, asylum seekers? Are you talking about people who do not have birth certificates, but who could be Malaysians, but do not have access to actually get themselves vaccinated? But if you really take a step back and look at Malaysia and vaccination access to migrant workers, it is so flip-flop that even somebody like me who actually works towards getting migrant workers to turn up at vaccination centers to get themselves vaccinated do not really know what's happening on the ground. Because firstly, you need to have this thing called My Sejahtera downloaded, and you need to fill in your particulars in order for you to be called in for registration. And even if you want to go and stand in line and do a walk-in, you need this My Sejahtera vaccination, this My Sejahtera application to have been downloaded and filled up. Now, for someone like me who works on the ground, it's such a frightening prospect, because I'm continuously worried that after the vaccination drive is over, that the government can actually use the data to actually go after the migrant workers, because their addresses are there already. And so this impending fear has actually kept a lot of migrant workers from actually going and getting themselves vaccinated. So Malaysia's 80% herd immunity remains very much to be seen. So I'm just going to take another 3 minutes to wrap up. I've got a note from Adib saying that, a warning saying that, hey, wrap it up. So the thing is, the good thing that has happened in Southeast Asia, in ASEAN, in the region, is that we are seeing lots and lots and lots of people, citizens, ordinary people like you and me, coming together to do everything they possibly can to those who are on the fringes of the society, migrant workers, both documented, undocumented, refugees, and others. And in Timor-Leste, we have the Women's Network and the Environment Network, which is coordinating emergency support. In Philippines, we also have a lot of lobbying effort asking for transparency in government procurement process. In Malaysia, we have the Kita Jaga Kita movement, which is a group of ordinary citizens who have come together to help those who are less fortunate than us, people like the migrant workers and others as well. Now, before I wrap up, I did say that at some point, I would like to talk about ASEAN and the fact that it has always been seen as a toothless tiger and nothing more, that ASEAN has failed miserably, whether in terms of actually coming up with social security for those who are vulnerable, for the migrant workers, looking at ensuring the safety of women migrant workers, or even as a body coming together to reprimand each other of human rights violations. But here, I see a lot of you who are representing different parts of the region, and you have come together to try and work and report. Now, I would like to ask you a question. Do you think that you folks can actually form a formidable alliance so that, beyond this 3.5 hours that you are with us, you will continue to communicate with each other, that you will continue to push and lobby for better media, for a better environment in which media in your respective countries can work in. And in the process of doing so, if one of you gets persecuted, would the others come together to actually lobby, to ensure that your rights are protected, that they will actually go on social media platforms, that they will go to their respective human rights organizations and lobby for you. So the question here is, can you be the alternative to ASEAN that never was anything but just a group of big boys, patting each other on the backs and having, maybe incredible meals during their meetings? So I really hope that, you will be able to do something, that you'll be able to come together, and that you will be able to form a formidable force that can be, that has to be reckoned with, and also act as some kind of a watchdog beyond today. Thank you very much.